Greetings that rapidly came to me. Thank you. I am really pleased to be here to speak to Bill 11. Like my colleague, I wish we had more time. There are 6 schedules in Bill 11, and I've made points in previous debates that I generally support Schedules 1 through 5 with some enhancements that I think my colleagues will touch on. And in particular, I support an increased level of accountability for private agency healthcare staffing reporting outlined in Schedule 3. So overall, I would like to support this bill. But then there is Schedule 6. Now, as you've heard today, the objective of Schedule 6 is to allow patients to have digital access to their patient records that come from different providers, whether it be a lab test from different labs, different hospitals, primary care teams. They would access it in one place. And I have been, Speaker, a very strong advocate for patient access to their electronic records since 2007. I've worked in the system, on project teams, on digital advisory committees to try to move this forward because the evidence shows it will result in better quality care for patients. And when I served in leadership roles in hospital, I asked this question everywhere I went: when will we get digital access for patients to their records? So initially, I was actually really excited to see this bill finally come through. However, when I read the Information and Privacy Commissioner's letter on December 12, 2024 regarding the bill, then known as Bill 231 last fall, I was confused as to why the government would reintroduce this bill this spring with virtually no changes. And there were 5 concerns, but I'm going to highlight 3 significant ones. 1, instead of expanding access rights for individuals, restricts access rights that were previously available. That's significant. It specifically authorizes the government to make regulations that could exclude requirements related to individual consent, one of the most fundamental privacy protections. And the third is that lastly, it says that there's a prescribed organization, which is not identified in the legislation. From our briefing with the Ministry of Health, it is expected to be Ontario Health that I actually have some confidence in to do this work and protect privacy. But why not be explicit then? As written, the minister can appoint any third-party company with this legislation. And actually today I heard there might be other options. So I've been watching this carefully. So when asked in question period, I was somewhat encouraged when the Minister of Health told the legislature that she'd been working with the Information and Privacy Commissioner office all through preparing this legislation. But, Speaker, then the IPC posted another public letter on May 27th. According to the Commissioner, that was a one-way conversation. That's what the letter says. It was a one-way conversation, and that one-way conversation goes back to the government's first attempts at these measures through regulation last summer. A total of 3 public letters from the IPC with their stated concerns and recommendations. And last week, we actually learned the IPC prepared the amendments. She did the work for the government. She prepared what the amendments needed to be for this to be acceptable. She also publicly posted those revisions so that we could go forward. And she did all that work. And the government appears, Speaker, to be choosing to ignore it. Fast-track this bill with no consultation at all at a committee. Now, as a previous hospital president, I made sure I had the expertise around me to make informed decisions on tough issues. That's what leaders do. It's not just in hospitals, in any organization. In this case, we have an officer of the legislature, the IPC, who has done everything that she can to inform you that this legislation needs to be fixed. Yet here we are, moving ahead with no opportunity for consultation, no opportunity for amendments. I and others, including the IPC, I had stated I was willing to make suggestions so that we could actually proceed, so that we could give patients access they need to this information. It is far too long. We are way behind in the rest of the country. It's right there. I just cannot understand why the government won't change it. Thank you.